Yeah.
Hey. So let me ask you, Mackie. So all I do is just push my little, because I have a Apple, so I just push the space bar and it'll go to the next one.
Yeah, or you can push the little
Oh,
arrow.
I see it right there. Okay.
Yep,
All
you
right.
got
Well,
it.
hello, guys. Thank you all for tuning in. I hope you guys are doing well. This is about the time of the day that the energy starts to go down on the fast, and you start to wonder, what am I doing? What was I thinking jumping into this? Why did Josh get me into this again? But trust me, it gets better. By the end of the day, I usually find that by the end of the day, my energy actually starts to get better by the time it's time to go to bed. So hang in there. But I am Dr. Shyrlena Bogard, for those who weren't on the call last night, and I'm an OBGYN by training. And now I specialize in lifestyle medicine and regenerative health. And so basically, I do a lot of hormone optimization and regenerative health modalities like stem cells, PRP, and things like that. So today we're going to talk about the holy trinity of your health, your gut, your hormones, and inflammation. And the reason why I call it the holy trinity is because there is such an intertwinement in these three. And a lot of times when you go to a physician, we look at it from one aspect, like we want to go and we just want to address your gut, or we just want to address your hormones. And so if you don't address all three, you're really not going to get the benefit of what you're trying to do. And it's like you're continuing to work an uphill battle. And so hopefully by the end of this talk, you'll kind of understand why it's imperative that you look at it from all three and not just try to go and hit just your hormones or just your gut health. So a little bit of background. So why do we do this intermittent fasting and detox? Why does Dr. Anthony love this and preach it? Essentially because, we do have toxin exposure. The average person in America gets exposed to about 14 pounds of pesticides and herbicides every year. And in fact, the CDC did a report that shows that each and every one of us has about 116 to 148 synthetic compounds in our body. So that means our cells are holding bits and pieces and particles of the things we've been exposed to, these pesticides and things are just living in our fat cells in our body. And so over time, if we don't eliminate these things, we get a toxic burden on our body because the liver, which is what actually cleanses these toxins out, the liver gets to a state where it no longer can do it. It becomes overwhelmed. And then we have a toxic burden. And then we get all the things we're going to talk about today. Also, a lot of us have inadequate elimination. We just don't poop like we should. I have patients who will tell me they poop literally once or twice a week, and a healthy, you should poop at least once a day, usually after every meal. And so the average person is walking around with about 15 pounds of poop in their gut right now. And that poop actually has toxins sitting in it, which are recirculating back into the body. And so all of that poop that you're not eliminating is harmful to your health because of the toxins that are allowed to recirculate back into your system. And further, because of all of the exposure to the toxins, there's oxidative stress on our body. So oxidative stress is what damages our cells. It's what causes aging. It's what causes death. And so the more oxidative stress we have, the more disease we have because our body no longer can heal itself. And we begin to go down this cascade of chronic disease. And so when we do the intermittent fasting and we do proper detoxing, we actually give our body a rest so that the cells have time to repair themselves and we can begin to eliminate properly, get rid of the toxins. And so in all these things, the toxins are released from the body and the body can begin to repair itself. So what happens to all that toxic ish that's in our bodies? So the toxins are actually fat soluble. And when the body sees anything that it does not recognize, it wants to protect itself. And so what happens is it takes these so like let's say if you eat some, I don't know, lunch meat, which is a processed meat, and you break it down and the body's like, what the heck is this? I don't know what it is. So what it does is it packages it inside of a fat cell. And then that fat cell gets distributed throughout the body, mostly concentrated in your abdomen and your midsection, which is what causes that abdominal obesity. Now, this is the protective mechanism for the body. It's like, I don't know what this is. It's harmful to me. I'm going to stick it in this fat cell, tuck it away so that I can protect myself.
Mm-hmm.
Well, when you diet alone, and this is what happens when people say, you know, the first time you diet, it works really well. The next time you diet, it gets a little bit harder. And then you have this yo-yo thing where over time, it gets more and more difficult to get rid of the fat. And Dr. Anthony has competed in the bodybuilding world before, and I have as well. And a lot of competitors will say every competition prep gets harder and harder because the body stops responding. Well, what happens is, if you look at these three pictures here, this basically shows you that in the first picture is this person has all of these little circles inside of his body are the fat cells that are holding all the toxins. So when you diet alone, you are decreasing your muscle mass. So you look at the person in the middle, you're decreasing your body mass, but the toxins have not been released. So now you actually have a greater toxic load on the body. So the fat goes away, the body is exposed to more toxins. So the body's like, oh my God, I need to make more fat because I got to protect myself from all of this toxin that's there. So we get this rebound effect where you make more fat because you didn't get rid of the toxins when you dieted. So when you do a proper, when you do a proper detox, and when you do the intermittent fasting and you allow your body to actually repair itself and process these things, you get rid of the toxins as well as getting rid of the fat, and then you're able to maintain a healthy lean body mass over time. And let me know if I'm talking too fast. So the pillars of our health, our gut, inflammation, and hormones. So we're going to start with the gut. The gut is the, it's the most, it's the biggest part of our inflammation system. And so it's our first line of defense. The role of the gut is, we all know it absorbs nutrients. And so the things we eat, it gets broken down in the body, and then it reabsorbs in the gut back into the body for us to use. It is the first line of our immunity system. It's where things are eliminated. So we break down foods. What we don't use is supposed to be eliminated out of the body. It does help with hormone regulation. And so when hormones are broken down, the metabolites are supposed to be eliminated. Whenever we have a poop, they're supposed to be eliminated. And so the gut plays a role in that. And then also there is a gut-brain communication with Dr. Anthony mentioned in his earlier talk. So the gut has a microbiome, and what that means, which most of you have heard of, is we do have bacteria in our gut. And so we have anywhere from 40 to 100 trillion bacteria, fungi, and microorganisms in our gut. And if you want to put it in perspective, we only have about 30 trillion human cells in our body. So we have more bacteria than we actually have human cells. And that tells you how important these bacteria are. So we have both good ones and we have some harmful ones. And what they do is they assist with digestion. And the more good bacteria we have, the healthier we are over time. Now, when we start to have an overgrowth of the bacteria due to a number of things, that harmful bacteria can damage the lining of our intestines, and it leads to what we know as leaky gut, which, in the medical community, there's about a 50-50. Some doctors still don't believe in it. Most are starting to, believe that it is a real thing. But once we get that leaky gut, then we start to see the association with the hormones, because we begin to see the hormone disturbances. And then eventually we get the systemic inflammation and all of the things that come from that, including chronic disease. So leaky gut. When you look at a healthy gut, if you look at the picture here on the right, a healthy intestinal lining, you have your cells are lined up. They have these really, really tight interfaces between them, these tight junctions that don't allow undigested food particles or anything to go through. They only allow digested food to pass through, and they keep the things that shouldn't go out from going out. They have these little ciliary, the little hair-like cells are there. Those kind of move in wave-like motion to keep all the particles moving forward. And then that top layer there is a mucus layer, and that mucus layer is a protective barrier for the intestinal lining so that it does not get damaged. Well, when we have a high amount of harmful bacteria, it begins to break down all of those barriers. So it gets rid of that mucus layer. It gets rid of all those ciliary hairs. And so things just kind of sit there. And then it also starts to put cracks in the lining of the intestine so that now we've got undigested food can get out of the intestine and go back into the circulation, into the blood, and circulate throughout the body. Toxins that are supposed to go out with the poop are now going back into the body and circulating in the blood. And so that is, what happens with leaky gut is we damage the lining of the intestine, we've got breaks in it, and now food particles go back into the system and wreak damage. And one of the most common things, the ways you can know that that's happening is when you say, every time I eat, 10 minutes later, I have massive bloating. And that's a sign that that undigested food is getting back into your system. When you have really bad allergies and itching and the bloating 20 minutes after you eat, that's a sign that you've got things recirculating back into your system that shouldn't be there. So the damaged intestinal epithelium becomes leaky. As I said, the harmful bacteria causes cracks in the intestinal lining. And then when those toxins and undigested food recirculate back into the system, we get the bloating, the gas, the headaches, the rashes. And sometimes, we're told we have food allergies when all it is we have food in the blood that's not supposed to be there. And over time, if that's not addressed, we begin to have systemic inflammation. So the body is going to mount a response to protect itself, and we get systemic inflammation. When that systemic inflammation occurs, we begin to have insulin resistance. And we're going to talk about what that is here in a little bit. But that leads to weight gain, resistant fat loss, and chronic disease. Also, when you have those cracks in the lining of the intestine, estrogen metabolites, which are supposed to be eliminated from the body, are allowed to go back into circulation. And the problem is, although we need estrogen, that's not a healthy form of estrogen. That estrogen that recirculates back is a toxic form of estrogen, and it does all of the negative things that estrogen does. And so it leads to abdominal obesity, a condition called estrogen dominance, which, if you've heard me talk before, I've talked about what estrogen dominance is. PCOS, endometriosis, breast cancer, because what happens is you're going to have a high estrogen load of toxic estrogen, and you don't have the progesterone, testosterone to counteract it. And over time, you're going to have some health problems from that. Also, the gut is actually where 95% of your serotonin is produced and stored. And so when you have leaky gut, those patients tend to have higher depression and anxiety because that serotonin is being leaked back into the system and not produced adequately. And there's also association with thyroid function. And this is one of those, you get into this cycle thing. The leaky gut and causes you to have suppressed thyroid function. And then the low thyroid function actually causes you to have an increased leaky gut. So that's just one of those cycles where, you try to figure out which one is the cause, but both have to be addressed. You have to address both the thyroid problem and the leaky gut problem. And then vitamin D, which is a precursor to hormones, vitamin D cannot be absorbed adequately. So a lot of times when patients are, I have patients all the time, well, I go outside all the time, my vitamin D levels should be fine. Well, when they have a problem with inflammation and leaky gut, they're not activating that vitamin D and they can't absorb the vitamin D. And so they are still vitamin D deficient in spite of having it in their diet and being outside in the sun. So let's look at your hormones, how they play. Estrogen and progesterone. So estrogen and progesterone actually have some positive benefits. They alleviate some of the oxidative stress on the body. They decrease the inflammatory cytokine production. And so And a lot of times as we get older, especially in women, and we're going through the menopausal, perimenopausal years, and we start to have joint pains, that's because of decreasing estrogen progesterone levels, because you're going to have increased level of those inflammatory cytokines as those estrogens go down. So progesterone and estrogen actually decrease the inflammation, and you can see, as you get older, you just get more stiffer and stiffer. Also, they assist with wound healing, and they help with the barrier function of the gut epithelium. When your estrogen gets low, now we have an increase in those pro-inflammatory chemicals, those cytokines, and that actually over time, because you're going to start breaking down that lining of the gut, we're going to end up with systemic inflammation, because all the things happen. The food gets back into the body, the toxins get back into the body, systemic inflammation. We also are going to end up with the estrogen dominance, because again, the estrogen is going to get back into the body. We've got high estrogen levels. Now we've got weight gain, we've got abdominal obesity, which causes systemic inflammation. And just a way to kind of bring it to light and make it a real life situation. In women who have ulcerative colitis and Crohn's disease, typically when they get pregnant, they go into remission. Rarely do they have flares during pregnancy, because pregnancy is a state in which they have high estrogen and high progesterone levels. And so because the estrogen and progesterone are anti-inflammatory and they have immune modulating properties, they decrease the incidence of flares. So what they do is they have a direct effect on the epithelial barrier. So there's a decrease in the breakdown of the barrier in the gut. And so those patients tend to do well during pregnancy. The interesting thing is they tend to also continue to have decreased flares after pregnancy. And that goes out for about 18 months, which when you compare that to women who take synthetic birth control pills or synthetic hormones, they don't get that same benefit. And now you would say, well, if it's estrogen and progesterone that are helping, why would they not get the same thing if they're taking the hormone replacement or the birth control pills? Because those are estrogen and progesterone. Well, synthetic hormones are actually pro-inflammatory. They cause inflammation. So if you're taking birth control pills and you're taking the synthetic hormone replacements, you're actually going to cause some of the breakdown in the lining of the gut and some of the inflammatory problems. And so this is just a real life situation that shows that the natural occurring estrogen and progesterone, they do have some protective benefits. And if we look at our cortisone and insulin, so cortisol, we know that's our stress or hormone, our fight or flight hormone. Cortisol directly influences our insulin levels and our metabolism. When we have high cortisol levels, that puts us in a pro-inflammatory state. So the body does not like to have a lot of cortisol. When our cortisol is high, we have decreased production of testosterone, decreased production of hormones overall. Now, it's actually, so inflammation is supposed to be a response to an acute and short-term stress, meaning we have this acute injury, the cortisol is supposed to go up, it causes an inflammatory reaction, the injury is repaired, and then the cortisol is supposed to go back down, and then the inflammation goes away. That's how it's supposed to happen. When that doesn't happen and we have a chronically elevated cortisol level, then we end up with hyperinsulinemia. So then what that means is we've got high insulin levels all the time, because cortisol causes us to release insulin. And what insulin does is it tells our body to store fat. And so we end up with increased fat storage, visceral fat storage, which means weight gain. And weight gain, so when we are obese, that is a stress to the body. And that stress causes increased cortisol levels. That increased cortisol level causes systemic inflammation, that systemic inflammation causes increased fat formation. The increased fat formation causes increased stress. And so you can see it's this vicious cycle that's really, really hard to get out of. And again, you can't just address one of them. You've really got to address all of them if you really want to get out of this cycle. And looking at your insulin. So insulin is produced in the pancreas, and it's produced in response to a given amount of food. So typically, as you know, what we eat produces sugar in our blood, glucose. And for a certain amount of glucose, the insulin produces a certain amount of, the pancreas produces a certain amount of glucose. Well, because the modern American diet is so full of sugars and processed foods and refined foods, what that does is it puts a strain on the pancreas. It takes more and more insulin to respond to those sugars. And so over time, it takes more insulin to deal with the same amount of glucose. And now we're walking around with excess insulin levels. So we become insulin resistant, and that is a pro-inflammatory state. That inflammation causes increased oxidative stress on the body. And that oxidative stress, as we said in the beginning, is what damages cells. Now, what's really, really, I found this to be, I read about this recently, is that there's this, and I don't know how new it is, but this new category of diabetes type 3, which is what Alzheimer's disease is. And so the oxidative stress damages the brain cells. It ages the brain. And I always knew that there was a correlation between inflammation and Alzheimer's disease, but I guess when reading it and putting it into just seeing it, it just, I don't know, brought it to light for me. But so inflammation does age the brain, and and it's a precursor to pretty much every disease. But now we've got this new classification of diabetes type 3, which is what they're calling Alzheimer's.
Wow.
And finally, inflammation. Ooh, I'm moving pretty good. So the function of inflammation, and it sounds like inflammation is just a bad thing, but actually it's a protective mechanism for the body in response to some physical or chemical injury. So it's the first step in our injury. It's the first step in healing for an injury. So if you think about when you have surgery, the inflammation comes in, you get swelling, it's a little bit painful. Well, what that does is it keeps you from moving that site where you had surgery so it can actually heal. If you did not have the inflammation, you're going to move around and you're going to cause further injury. Also, that inflammatory process brings in the white blood cells that, go in and fight infection, or the things that go in and do the healing. And so it has a function. It's just that it's supposed to be an acute reaction. It's supposed to go in, address the injury or the stress, and then it's supposed to go away. Now, when we have chronic inflammation, that's when we end up with our poor health and disease and eventually premature death. Most diseases are induced by inflammatory processes that have not been addressed. And so, as you can see, you really have to address inflammation before you can even begin to think about having wellness. And so you really can't say, I'm going to lose 20 pounds and not deal with the inflammation that you have. And a lot of times, like for me in the office, when I've had women who, let's say, have had menstrual issues, and looking at her lifestyle, I know there's inflammation and she may want to have a hysterectomy. And it's like, if we address the things that are causing the inflammation, a lot of times the menstrual issues will correct and reverse. And number one, we don't have to do a surgery. But number two, if I do the hysterectomy and we have not addressed the inflammation, she's going to continue to have health problems that are going to get worse and worse. And one of those being cardiovascular disease, which is the number one killer of women over the age of 50. And so it's very imperative that we in the healthcare field understand the importance of addressing the inflammation when we're addressing anything. So what are the symptoms of inflammation? pretty much everything. Body pains, muscle ache, joint. It's like, and the thing is like if you look at hormone insufficiencies, you look at cortisol, it's like they all overlap. And this is why I say you can't really address one, because when thyroid is off, there's a cascade of things that happen, and you really can't tell what's causing what. So chronic fatigue and insomnia, not sleeping well at night, that could be low thyroid, that could be high cortisol, that could be inflammation, depression, anxiety, and mood disorders, gastrointestinal disorders, weight gain and unintended weight loss, allergies, frequent infections. And you see this little diagram here that kind of shows you the inflammation is kind of the center of all these things that are going on. And so you have all these diagnoses that we get. And a lot of times the root cause is the inflammation that needs to be addressed. And by addressing that, it gets easier to alleviate a lot of the other, and a lot of them will take care of themselves. Actually, if you get rid of the inflammation, acne will start to get better. The gastrointestinal issues will start to get better. Your hormone balances will improve. And you will find it's actually like the belly bloat will go away. The weight starts to come off easier, but it starts with addressing the underlying cause. So what can you do? Adopt a nutrient-rich and anti-inflammatory diet. Take a medical-grade probiotic daily. I always tell my patients, don't buy anything off of Amazon. I know Josh doesn't want to hear me say that, but when it comes to probiotics, you want to make sure you've got live cells in there. And so for me, I personally, I like to go for the ones that are refrigerated. That just makes me feel better. But there are shelf-stable probiotics, but you want to make sure you have a good variety of bacteria in your probiotic and you're taking it daily. One interesting thing is that most healthy people, if you have healthy gut flora, you're someone who's at the peak of your health, there's no benefit from taking probiotics. And so multiple studies have shown healthy people don't benefit from taking probiotics because they already have a healthy balance of the, that doesn't mean don't take them. And then prebiotics. So prebiotics are the food for your healthy bacteria. And what that is, it's fiber. And so the undigestible fiber that's in like cruciferous vegetables that we can't digest, the healthy bacteria in our gut can actually digest that and use it as food, and it proliferates the growth of the healthy bacteria. So you can take a supplement, but the best way to get it is from fruits and vegetables. Like I had a list of them, I completely forgot, but green vegetables, the cruciferous vegetables, green bananas I saw on the list. I don't know how you eat green bananas, but the fruits and vegetables are going to be the best way. But there's also a lot of times I see now they have the probiotics that have the prebiotic in with it, because there's the understanding that you want to actually stimulate the growth of the probiotics. Eliminate sugar. So sugar, we all know, is one of the most addictive drugs, and sugar wreaks havoc on the gut lining. It will tear that lining up. And you will, for anyone who has any gut issues, and you'll see the minute you eat sugar, you start to have all of the really bad bloating and the headache and things like that, because sugar does wreak havoc on your lining. So get rid of the sugar, the simple carbs, and the refined foods. Eliminate artificial sweeteners. Artificial sweeteners actually are food for the bad bacteria. So the prebiotics feed the good bacteria, the artificial sweeteners feed the bad bacteria. And also, there was a question earlier about taking stevia. So natural sweeteners do not have that same characteristic. So it's okay to take monk fruit, stevia leaf, raw honey, and agave. Those are actually okay to take. They're not inflammatory, and they don't have any effect on the harmful bacteria. Consuming polyphenols. And so red wine, dark chocolates, what they do is they go in and they get rid of free radicals. And so they decrease the oxidative stress, and they help to protect your cells. Antioxidants, I couldn't think of the word. So they have an antioxidant property to get rid of the free radicals that damage our cells. And as much as possible, only take medications and antibiotics when you absolutely need them. So many of our medications have they, like, if you look at Synthroid, which is the prescription medication for thyroid disease. Synthroid, the coating in it has gluten. And a lot of people have a gluten sensitivity. And that doesn't mean you have celiac disease, but the gluten is damaging to the gut. So as much as possible, stay away from medications that you don't need. And then antibiotics, as you know, they don't just wipe out the bad bacteria, they wipe out everything. And so a lot of times, if you've been on chronic antibiotics, you have a lot of gastrointestinal issues. And sometimes you will begin to grow out pathogenic forms of bacteria. And so really, really important, if you're going to be on an antibiotic, to also be on a quality probiotic at the same time. Lifestyle, so decreasing stress, because again, cortisol is so huge. We had a question in Dr. Anthony's talk about managing cortisol. The best thing you can do is manage the stress in your life. So daily meditation practices, starting your day out, setting yourself up for success during the day, because that's going to decrease your stress when you start your day off with when you have a regular practice in the morning. Getting adequate sleep at night, regular exercise, that's going to raise your serotonin levels. The exercise, it also helps with your hormone balance. It helps to support healthy testosterone levels. And when I say exercise, remember, this is not overdoing exercise. The one thing about stress, the body it doesn't differentiate stress. The body doesn't know the difference between I haven't slept in 3 days and getting chased by a bear. To the body, it's all the same. Stress is stress is stress. So the response is the same. Obesity, the response is the same as getting chased by a bear. So over exercising gives you the same response as overeating.
Wow.
Getting out, getting some sun, getting that vitamin D going. And also what Dr. Anthony said earlier, because for people who have problems with their circadian rhythms, that's the best way to reset your circadian rhythm, is to get out early in the morning and get some sunlight, because that tells your body this is the start of the day to begin, your 24-hour circadian rhythm. Avoiding estrogenic compounds. And so a lot of the things that we get exposed to that have those exogenous estrogens, some of the cosmetics that we use, the hairsprays, pesticides, things like that, and a healthy sex life, because it's actually shown to decrease your stress and it supports healthy hormone balance. Getting good sleep, a regular sleep schedule. It's one of the things that I think, especially here, we're such a go society. We underestimate the power of just getting a good night's sleep. Yeah. And because that's when our body repairs itself. And when we don't give it the time to do that, over time, we begin to get, the systemic inflammation, and our body breaks down in disease. So regular sleep, getting 6 to 9 hours at night, good sleep hygiene. So a nice cool room, not having your cell phone in your hand, under your pillow, on the nightstand, getting it away from you. Waking at the same time each day has been shown to be more important than going to bed at the same time. It's always a question, which is more important. And finally, addressing any hormone imbalances. So get testing. There's 3 major ways you can test your hormones. You can get it through blood tests, through your urine, and through your saliva. They're all pretty good. They all have pluses and minuses. Your thyroid can only be tested with your serum. And then for cortisol is the only one I would say. Actually, I take that back. I used to say only use saliva, but now I prefer the urine, because you can test the metabolites in the urine, and that gives you a really, really good picture of how your body is processing and what's being recirculated back and what's being eliminated. So I really like the urine test now. And then BHRT versus HRT. So bioidentical hormones versus the traditional synthetic hormones. Synthetic hormones are pro-inflammatory. That is why they have an association with cancer, because inflammation causes disease and eventually, and that is why we as gynecologists are taught to, take women off of hormones, because synthetic hormones do have a association with causing cancer. Bioidentical hormones, on the other hand, are naturally occurring. They're plant-based. There are no studies that show that they have an increased association with any cancer or disease, outside of, someone having like a tumor cancer gene. They do not induce inflammation. And so there are no American studies that have been done to support their safety. But if you go to the European journals, there are lots and lots of studies to show that they have a safer profile than using the synthetic hormones. And I think that is it. Yes, thank you. And I finished in 37 minutes.
Excellent. Thank you so much. Let's open up for questions. What questions do we have?
I just think it's fascinating, Dr. Shyrlena, how everything is so intertwined. And you're right about all this cycle. It's like you talk about one thing, but then it's like it just keeps coming back around. It's like the chicken or the egg thing, which I just find so fascinating.
Yeah. And it's, and I think we underestimate how important it is, because even in medicine, we have a tendency to want to break patients up into body parts. And we forget there's a whole person that needs to be addressed. And when we go back to having a holistic look at people, it really changes the scope of how we, for me personally, of how we approach medicine. There is one question here: do probiotics survive stomach acid? Yes. So most of them have a protective coating on them so that they get through the gastrointestinal tract and get to the gut where they need to be. So yes, the probiotics do survive the stomach acid.
I have a quick question about probiotics, Dr. Bogard.
Yes.
You said to get medical grade and stay away from just online or over the counter. Would we get that through our doctors, or can you get medical grade without having to get a prescription?
So places like, Whole Foods, I trust most of the brands that they have at Whole Foods. Some of if you have local stores that have natural foods, I have, there are some nutraceutical companies. So for my patients, usually I will either recommend brands from Whole Foods that I've looked at, or the nutraceutical. I use orthomolecular products because they're pretty solid brand. They can only be purchased through physicians. Orthomolecular doesn't sell directly to clients. They're non-retail. And I'm not, you can obviously get them on Amazon. It's just, I feel like we're in a day and age that you just never know that you're getting what you ordered on Amazon. And so people are getting very savvy at replicating stuff. And if you
Good
take a
point.
probiotic, you don't want to just take this capsule with powder in it. You want to know you're getting some active bacteria. And so you try to do your due diligence to make sure you're getting what you're paying for, because they're expensive.
Yeah. Okay. Thank you.
You're welcome. Is there a test for leaky gut? How do you know if you have it? So I believe there is a test. I personally don't do tests, but I have seen with some of the lab companies, they have a panel of tests that, because what they do is they look for signs of inflammation. And so you look for increased inflammatory markers in the blood. And that's a sign of leaky gut syndrome, because you're having things in the blood that shouldn't be there. And so there are panels that are specifically looking for certain cytokines, inflammatory markers that are indicators that you have leaky gut. How do you know that you have it? So if you're having issues, it's one of those things like it's definitely if you're having lots of gastrointestinal issues. I think the earliest things that people experience are gastrointestinal issues. So you can have diarrhea, constipation, and then having the bloating, swelling. So having swelling in your joints, water retention, having headaches, foggy thinking. Those are all signs of leaky gut. And then having rashes. And so a lot of times People will have allergy symptoms where, you know, you have to live on Claritin. You have lots of mucus production. Those are signs of leaky gut syndrome because you have these allergies constantly. And they could be signs of fungal overgrowth, which again, you're recirculating back things back into your system because they're leaking from the gut. Can't stay asleep and believe it's hormone based. David, so yes, it can be. So testosterone, I don't know how old you are, David. Testosterone definitely affects our ability to sleep. And for men, especially if your testosterone begins to go down, your sleep is affected. Also cortisol. So if we're having a high stress life and your cortisol levels are high, your brain it won't shut down. And so you're not able to get a good night's sleep. Estrogen in a man, if your estrogen level is high, it can affect your ability to sleep. Whereas for women, it's the opposite. And if you have low testosterone as a man, you most likely have high estrogen. So it can affect it. I would definitely recommend getting some hormone testing if you have not had any hormone testing. And then also melatonin, if you've not tried melatonin. I like to, again, I always go to, I prescribe the melatonin. You can get it over the counter. The thing is, the over the counter melatonin is usually about 2 milligrams. Most people will need a lot more than that. What I usually have my patients do is we titrate the dose to see what you need to stay asleep. So the first night we'll start with 2 milligrams. And if you don't sleep, the next night we do 4. The next night we do 6 until we find the dose that works for you. Most women will be about 6 or 7, most men somewhere around 10. You can go up to 20, although, you know, if you told your regular doctor that, they'd probably say that's way too much. But you want to address the underlying problem and not rely on that long term.
I don't know if you can hear me, but I'm on the car. But the sleep issue started with the stress event that caused me to wake up in the middle of the night, and then it just became this like vicious cycle. And I've taken as much as 25 milligrams of melatonin and different things, and it just never seems to quite work.
So if there's a stress associated with it, there may still be have you ever had any like cortisol testing or anything? Broken up.
Oh no, I think we lost you.
Tested. I've had the pee, the poop, the blood, the. Am I back?
Yeah.
Back, you're
I can hear
back.
you now.
So can you repeat that?
I'm sorry. I've had. So I've had Genova tests, Dutch hormone tests. I mean, every bodily fluid has been tested, and solid and liquid. So I do have like a high cortisol, and I've done different supplements and different things, but I just can never seem to quite get where I can fall asleep in a millisecond, but I wake up around the 3rd REM cycle, and I either go right back to sleep or I'm up 3 or 4 hours. And it started with a single stress event, buying a stupid house that, you know, I was like, oh my gosh, I really want to get this house and, you know, get the mortgage and get everything. And then before that, I was known as like a coma sleeper. Like you could light firecrackers in my nose, I wouldn't wake up. And it's just kind of become this, I think, this circle or a vicious cycle of just never quite getting back into it. I've tried cognitive behavior therapy where you set your times to go to sleep and stay awake. And I did that, but it worked for about 4 or 5 weeks. But I feel like whatever the hormones are is pushing back. It tamps it down, but whatever's inside, you know, erupts back up. So it's been a quest.
Are you on any hormone supplementation now?
No.
Do you remember what your testosterone was?
400, 300, 400. I'm 48 years old, by the way.
Okay, so that's actually pretty low. And your cortisol level, what did they give you anything to support? So it sounds like you actually need cortisol suppression as opposed to cortisol support. So
it was one of the tests they were showing that my cortisol was spiking at night.
Right.
So, which is maybe causing it. So yes, trying something to get cortisol to go down would be ideal in my opinion. but
Right.
I
Well, we
have a
can-
liberal arts degree, so I don't know anything.
I was going to say, we can definitely talk off of here, and that's what I'm seeing. I'm hearing is that you need something to during the night to actually suppress your cortisol. And the treatments are different. And so sometimes there's a tendency to think we've got adrenal fatigue and there's a, one-stop shop, let's just treat adrenal fatigue. But there's actually, as you see, two different issues. One is we need to support cortisol production. One is we need to decrease it. So I definitely think we can talk off of here and I can make some suggestions for you.
Fantastic. Thank you so much.
And Josh has my contact info.
Cool. Any other questions?
I had a quick one. What does too much exercise look like?
Yes, that's the question. I'm dying to know what too much.
Like, I started with a trainer, and I know that like one of their goals, like jokingly, is like they want to make me puke. So I want to know, like, is that maybe not the most appropriate approach, but more importantly, I wanted to know like what that looks like.
Too much exercise actually looks like not enough rest between exercise sessions, not allowing yourself recovery. So you can go hard as you want when you get there, because it's not like you're going to go to the gym and go hard for 12 straight hours. It's going to be a short session, which is perfectly fine. It's the allowing your body to recover. So if you're working out 3 to 5 times a week, that's typically okay. But you should have a day off where you rest and allow your body to recover. And if you're someone who's going hard at it, you should not go more than 3 days in a row. After the third workout, you need a day of recovery and getting sleep at night. So it's more the recovery than actually going. I see you're going to go to, I don't want you to tell your trainer, Dr. Bogard said, I can't go hard. So, but no, it's the recovery, not allowing your body to repair itself.
Okay.
All right.
What other questions do we have? We have some trainers on this call too, so everybody watch out.
All right.
I won't call them out.
I saw one of your slides had like brain fog, and that's something that I feel like I have a lot of. Maybe I'm just, I don't know, always foggy. But I don't know, is there any suggestions to help just not, sometimes I sit down at the computer and I'm like ready to go and I'm just like, you sort of like glaze over, and I don't know.
I have to do some more reading, but there is some like pregnenolone is one of the things that I've read for men, especially if there's some brain fog issues going on. We don't always look at progesterone and things like that in men. And so I have to do some more reading on it, but that's one of the recommendations for men who complain of brain fog is
May I comment on that?
Of course.
Can you hear me?
Yes.
Again, I have a liberal arts degree, so I don't know anything. But what I do know is when I was doing all of the tests that I've done, one of them was in the Genova test, was a food sensitivity. And I'm not allergic, sensitive, like off the protein and one of the proteins in dairy. And I used to eat cheese every day. I'm in the wine business, so I come home, have a glass of wine and a piece of cheese. So I cut cheese out, and the brain fog, whatever I didn't call it brain fog so much as I called it like there was like cobwebs in the corner of my eyes. And ever since I took dairy out, it's made a big difference. So I don't know if he has done any sort of food sensitivity tests, but that personally helped me was taking casein out, which, because I was, again, IgG or IEG or IIG, whatever those things are called. It was on a scale of 1 to 1,000, I was like 2,000 plus on casein. And so I just cut it out, and I use olive oil or ghee instead of butter. And the very rare chance I get a cheese, but it changed the brain fog issue for me personally.
Right. Yeah, and that's very, very true. I can say food sensitivities, again, we underestimate their effect, and just by taking one little thing out of the diet, it makes a huge difference. So yeah, that's actually something that should be always looked at. The first thing to look at actually is your diet. But your diet's pretty healthy, right?
I
Mine?
mean, oh wait,
Oh,
who's?
Toby,
Davis.
Toby.
Never mind.
I mean,
Toby.
I do have the sugar attacks here and there, so I try to be healthy.
Because
I don't know. I
Toby's
feel like
Revivery alum, so I know he's, you know, he knows all the things.
I have moments of health. I feel like I've been falling off the wagons, all the wagons recently.
All
We're
right,
all
we have
pushing the wagon.
time for one other question. I'll wrap up with a few notes.
Okay.
Anything else, guys? Any other questions? Okay. So just to wrap up, thank you, Dr. Bogard. That was awesome. I appreciate that. We'll send out the at the end the information and the recording for this as well.